know the steps that will be required to not just initiate, but sustain a career in research, whether you are in the academia or not. I would also like to identify some key areas that one can delve into clinical pharmacy research in Nigeria that will have impact on the healthcare trajectory of our country. Finally, I have the objective of hoping to tell us where we can fund researchers that want to conduct, as well as where we can get collaborators that will help us in our research. So why was somebody interested in clinical pharmacy research? We're interested in clinical pharmacy research because that is the form of research that optimizes the use of medications that will improve outcomes in our patients when they use our drug and not drug interventions, as well as generally advancing pharmaceutical care practices. We are aware in the famous definition of pharmaceutical care by Strand, we talk about providing drug therapy, we talk about responsibility, we talk about improving patient outcomes. So in clinical pharmacy research, you want to see that if you're going to be involved in pharmaceutical care, you're going to be involved in medication therapy management, whatever you're going to be involved in, it should be evidence-based. And that evidence should come from research. And the one that has to do with the drug in this case is clinical pharmacy research. So let me just say something here. I would have made pharmacy in this point to be bold because it passes a meaning. You are not just conducting clinical research, you're not just conducting pharmacy research, you're conducting clinical pharmacy research. So it means that at any point that you want to conduct a study, like today, I was discussing with a fifth-year PharmD student in my institution, and the topic was about perception of acne vulgaris by adolescents. So I said that as long as you stop at just the perception of the disease alone, you are into clinical research, you're not into clinical pharmacy research. You will see that you are into clinical pharmacy research if you not talk about perhaps self-care management practices, drug and non-drug use management of acne vulgaris. So I want us to start by knowing that whenever you say that you're conducting the clinical pharmacy research, there should be that component that is in pharmacy, that is in that your work. The aspect must not necessarily be about drug. We have outcomes. If you see patient outcomes, outcomes could be economic. So if it's economic, for instance, we're talking about cost effectiveness analysis, cost utility analysis, cost benefit analysis. These are forms of patient outcomes as far as economic outcome is concerned. We can talk about humanistic outcomes when you mention satisfaction with care, quality of life, when you talk about knowledge perception. These are forms of outcomes because they're form what we call humanistic outcomes. Then when you talk about clinical outcomes, talk about disease progression, talk about cure, you talk about palliation, you talk about all these things are also forms of outcomes because they form what we call clinical outcomes. So if you're going to conduct clinical pharmacy research, you must take that caution in conducting research that is into clinical pharmacy. And so in this case, I may want to mention also that you hear colleagues who talk about conducting studies in public health pharmacy. So if you say you're going to conduct a study in public health pharmacy, it means you should remember that part, pharmacy, in your word, in your area of practice. So it's not just public health practice, but public health pharmacy practice. So in that same way, I want to understand that in this definition, one thing that is key is medication use, patient outcomes, and advancing pharmaceutical care. So you will see clinical pharmacy research that is involved in optimizing drug therapy. You will see them talking about medication safety and adherence. And in adherence, in this case, I want us to understand that we have adherence, we have compliance, we have concordance, which are current terms that are being used. But adherence generally is used to cover all of them. Like I mentioned earlier, we have other outcomes like economic outcomes, where pharmacoeconomics comes in. And we have newer areas now that are coming up, the pharmacogenomics, personalized medicine, precision medicine. About 2 days ago, I was discussing with a professor from the University of California, San Francisco, and we're planning to conduct a study, and we observe that in Africa, there's not much that has been done about precision medicine that involves people living with HIV. So it's an area that one can decide to go into. I have been mentioning that you don't say you're conducting a research if it is not clinical pharmacy based in our own area of practice. And because with all this thing that we're doing, we want our patients to be treated in a way that it's not just because Mr. A will claim unsubstantiated claim, not because Mr. A will come up and say that I have been doing this over the years. No, we want to see that any practice that is done in providing services to patients should be through evidence. The evidence should be objective, it should be clear, there should be no bias, and it should be something that you and I, even if we close our eyes, we can defend it. We also want to be involved in clinical pharmacy research because we want to solve problems. We have several problems, both those that are related to us Nigerians as a local challenge now, and we have global health challenges. The entire world now is a global, single global village, and health for one affects every other person. About 20 minutes ago, I just came out of a webinar with the Global Burden of Disease Consortium, and they're talking about the increasing rate of diabetes in the US, and they saw that there's no other country in the world that has the prevalence and the rising incidence of diabetes as you have in the United States. So despite the good level of healthcare delivery, the good level of economic power of the people, you can see that they still have issues. So we want to conduct what are our local problems? How do we solve these local problems? How do we solve problems that are happening in our neighboring countries? Because as you talk about problems in Nigeria, you also have to know that in Nigeria today, we have borders that are open, land, air, and sea, and people come in every day. So whatever affects us, affect them. So conduct research because we want to address these challenges. It could be availability, it could be prevalence, it could be use of evidence in taking decisions. It could be talking about rising resistance to different drugs that are available. It could be about discussing the life expectancy, human capital index, and other factors that affect the healthcare system. If we're also involved in clinical pharmacy research, we're able to enhance that we play as pharmacists whenever we are involved in multidisciplinary team. Because you can't just say that you are a pharmacist. Unfortunately, as we have today in our program, with your B.Pharm alone, you can rise to the pinnacle of your career to become a director, to become a permanent secretary. But with our colleagues in other sectors, some of them in their own areas, they rise by qualifications. And to be able to do this, you have to that come for clinical meetings and they are able to take decisions because they say that I read just a few minutes ago an article that was released in New England Journal of Medicine. If you say that whoever is in the room listens to you, whoever is in the room, and you mentioned that you read something just this morning in a journal like New England Journal of Medicine, in the Lancet, and this is what they did, and you are also able to do something like that, they'll listen to you. You also say that we did a study 2 years ago, and it confirmed that this happens. They'll listen to you because you say that you have done a study, it is published through peer review mechanism. They will respect you and they'll be able to listen to you. That's the only way that you can make yourself to be important as far as multidisciplinary healthcare system is concerned. And finally, if you are involved in this aspect of research, you'll be able to contribute to the development of both national and international policies that have to do with the healthcare sector. You can't wake up today and say that you are going to participate, for instance, in changing dosing of a drug, in changing something that has to do, for instance, with the use in a particular disease or state. You can't say that you're going to contribute to the prioritization of different interventions in the management of a disease state if you do not have evidence to show. The only way that can get the evidence is through research. Okay. So now let's come back home to Nigeria. We've mentioned our impact globally. We've mentioned our impact and what we can do in the multidisciplinary healthcare system. But somebody may ask, why are clinical pharmacists in Nigeria interested in research. And why should you, the mentee, someone that is just serving, someone that just finished service, someone that is an intern, someone that is a final year or in the penultimate class in pharmacy school, why is that person interested in clinical pharmacy research? And what are the opportunities that are available for you to tap into? The first is that in Nigeria, we're a country that contributes a lot to the global burden of many diseases. If you call malaria, if you call HIV, if you call tuberculosis, these are conditions that the prevalence in Nigeria is high. Why is the prevalence high? It is high because, one, we have the population. Remember when we mentioned prevalence, we talk about the population of the people itself, and we have the population. So when you take 1,000 people in Nigeria, for instance, it's very unlikely that you not see malaria as a disease state in them. So since we have this high burden of diseases, you can't say that there's no disease for you to study. So the first advice tonight is that look for an area, look for a disease state that is of interest, not just to you, but also to the global community, but it's local to Nigeria as well. If you choose this and you decide to master it, I can assure you that you've created a niche for yourself. So we have a lot of them. These are just a few. Vaccine preventable diseases, we have a lot of them in Nigeria. So what can you do as a clinical pharmacist in providing evidence in their management, in providing evidence to change policies? We have the issue of rising prevalence of what we call non-communicable diseases. These diseases are not infectious, but they are also diseases that contribute a lot to the global GDP. That the diseases that affect the national GDP, sorry, how do they affect it? These diseases lead to increment in expenditures. These diseases affect the National Health Insurance Agency budget. These diseases also lead to loss to productivity because as people have these diseases, sometimes they have to go for treatment, and so they are not able to come to work today. You need something to be signed, and they are not there to sign it for you because they are sick. If you are a clinical pharmacist and you are involved in this type of studies, then you are able to document ways that its prevalence could be reduced. We have a publication with a colleague in which we talk about the role that pharmacists could play in reducing the negative outcomes of the hypertension management. And what she did was to have two pharmacies, two in Kogi State, two in the FCT, where you have both control and intervention to make up for differences in location. And in one of the centers in each of the communities, each of the states down, the intervention was to provide pharmacist-led self-care management practices to the patient. And at the end, we found out that quality of life using SF12, SF12 is a tool that's used to measure patient satisfaction, health status. And in the finding, we observed that their quality of life improved. That is, those that were in that intervention group, they had a better quality of life compared to those who did not get enrolled into the intervention group. We also observed that even outcomes increase in those, better outcomes increase in those that were in the intervention group because it was a pharmacist-led work. This study is published in British Journal of Clinical Pharmacology. That is a global journal. That is a journal that has high reputation and impact. And this work stems from Nigeria. That's what the clinical pharmacist has done. Medication safety and adherence challenges. In Nigeria, we have issues with medication safety. We have the pharmacovigilance unit of our NAFDAC, which has been doing its best, but we know that there are challenges and there are ways that we can come in to look for how to solve these issues. One work that we published last year, a colleague brought up this idea that what he was doing his internship in NAFDAC, and he got exposed to the issue of pharmacovigilance. And he wanted to know the capacity of Nigerian pharmacists in certain institutions to conduct, to deliver this pharmacovigilance service. So he went to all the area councils in FCT and asked for the head of the pharmacovigilance, just a few. So you can imagine the whole of FCT. We don't have many local secondary healthcare facilities. He met them, got their input, and it has been published. And this work, as just last year, they started having citations because it contributes significantly to the evidence body of knowledge that we have. Through research, we're able to mention what roles our traditional medicines can play and what they can be used for in modern healthcare. We call them traditional, but remember that it's what we call traditional that some people call to be modern in their cities. And this has come as a result of research. So what have you done about your tamarind? What have you done about your, as a director indicator, what have you done about your, all these plans that we have? What have we done about them? What is the role that these drugs can play in our national healthcare service? Today, you hear about the fear and the crisis about withdrawal of funds from many disease states. If we have been tapping into what we have in our countries, what we have in our communities, our villages, and we're able to bring them up through evidence, and people will listen to us. Then, luckily, Nigeria is having this increment in pharmacoeconomics and its role in health decision making. I'm currently involved in a research with a vaccine consortium involving Nigeria, Zambia, and Kenya, where we're talking about prioritizing evidence, pharmacoeconomic evidence in decision making by policymakers as it has to do with vaccines. These are roles that pharmacists can play great part in, if only we tap in from these our resources. Please, are we together?
Very well, sir.
Yes, we are together.
Good, thank you. So let me
we are following, sir.
Thank you. So let me stop at this point and just take one of the topics that colleagues wrote out when we gave the opportunities. Yeah. This wanted to what we are considering the effectiveness of care. We want to assess the effectiveness of antimicrobial stewardship in community pharmacy. And they are choosing to conduct this study through a retrospective study. What is a retrospective study? We're going to hear that we have what we call study designs. If you want to divide all studies into two, you can say cross-sectional and longitudinal. Whenever you collect data from a site only once, that is cross-sectional. If you collect more than once, either from the field or from an individual, it is longitudinal. It is retrospective. If it is database, then you are going to use existing data to conduct your research, just to conduct, do your data analysis and be able to bring out evidence. So for this person that said that he wants to conduct a study, retrospective, to examine the effectiveness of antimicrobial stewardship. What is antimicrobial stewardship? We know all those concepts about how to reduce AMR, antimicrobial resistance, and he wants to use community pharmacies. And using community pharmacies, he's talking about the effectiveness. So what type of effectiveness? Is it clinical effectiveness? Is it its role in reducing drug utilization pattern, antimicrobial drug utilization pattern? Is it its role in reducing resistance? Is it its role in sustainability? How many have been formed? How many have been sustained after the formation? These are gaps. These are loopholes in the topic. The way you say that you're going to conduct a study that is retrospective, somebody may ask you that what is its contribution to decision making as far as today is concerned. You're talking about antimicrobial stewardship, and you are saying that you want to do it retrospectively. How many pharmacies do you know that have been doing that? Unfortunately, the topic says a community pharmacy. So let us assume that community pharmacy has an AMR or antimicrobial stewardship program ongoing in that community pharmacy. The next thing is that how do they document their formation? How do they document their practices? How are they able to combine their work, the value of what they're doing in community pharmacy, with documenting real-life information that can help you when you come to do this retrospective study? You as the pharmacist, somebody will also ask that, do you know whether they had in mind also that somebody will come tomorrow to go and assess the effectiveness of their program. And so they gave you, they documented the relevant information. These are limitations that may affect your work. So with this, I want us to discuss the next point, which is challenges in conducting clinical pharmacy research in Nigeria. So when we don't have this mentorship, when we don't have this right training, we'll have a problem. I'm happy that in the PharmD curriculum, I know from my institution, the University of Nigeria, we now have research technique as a course, not just a topic, as a course on its own. We also have data analysis as a course on its own. So with the mentorship that's provided by to the students at that level, it means if they go out, they're able to be independent researchers. So we have the problem of lack of mentorship in the research space in Nigeria. You hardly see a group of people who are under one dedicated leader showing them how to conduct research. We also do not have adequate infrastructure. We have a poor access to data because our data saving attitude is very, very bad. When I needed to conduct a study during my master's and PhD, I needed data from the teaching hospital, some teaching hospitals, about 6 of them, on drug use in the HIV clinics. I observed that when I got some data from Nigeria, and I compared with one that I got from Harvard School of Public Health through APIN, I found that I got from the United States gave me better information than the one that I got from Nigeria. Not that the one that I got from Nigeria was that bad, but I observed that the data saving practice, the fidelity of the data based on what I saw and how they were organized was a different ballgame. So we have that problem, but there are ways to always navigate them. The navigate is that you go to the right source. You also, on your own, contribute your quota whenever you have the opportunity. If you are in any facility, try and document what you are able to document. Try and see how you can save this thing for the future, even if you know you are going to use it. During my internship at University Teaching Hospital, with some of my colleagues were able to just do a review to available examples of what I have passed through. Not because I want to show what I have done, because I want to open up our minds as young pharmacists and early career pharmacists that wherever you are, the opportunities for research. Don't wait until you leave the school. Don't wait until you graduate. Don't wait until after internship. Don't wait until after NYC. At every point, the opportunities for research. My project during my internship period in ABU Teaching Hospital is currently published and is available online for use. Whenever I see it, I remember that when I was doing my internship, I did the study in the hospital and it's available today for people to read. So whenever you have this challenge, look for a way of resolving those challenges. Then also have the problem of balancing clinical practice with research. And I'm sure this one affects a lot of our mentees. Let's say you are doing, you are involved in internship, you are involved in NYC, or you're just doing your locum, and in the place they tell you that don't come to that place with a phone, keep your phone somewhere. I learned certainly that of one organization that said that they should not be using their phones again. The phone should be far away in the bag. They should only use earpiece, maybe one that can be connected wirelessly to those devices. Why? Because the business owner, for instance, is interested in the profit, and so he believes that the clinical practice should not give way for the business. Just like the person that wants to do research will be told they can be involved in research if you are going to be in my facility. It's either you choose one of the two. I remember when I went to Sierra Leone last year with some of my colleagues, younger colleagues who were interns. One of them was told that that was her last outing during this internship. If she should choose to go for internship for any other conference outside the country or outside Lagos, then that is the end of the internship. So I'm aware that we'll have this problem. And so there are ways that we can resolve them. One way to resolve them is on your own, define your path early and know what you want. In your job interviews, try to understand what you want and discuss with the recruiters on how you want to be treated. Also have the issue of limited publication opportunities. We do not have enough high impact factor journals in our country. For instance, in Collaborate, where we have some of the best cited, index journals. As far as the pharmacy space in Nigeria is concerned, the only pharmacy journal that's indexed in journal citation report is the one of University of Benin Faculty of Pharmacy. That's the TJPR, Tropical Journal of Pharmaceutical Research. That is the only pharmacy journal in the whole of Nigeria that's indexed in what we used to call Thomson Reuters, but now called JCR, Journal Citation Report, Web of Science. We don't have another one in Nigerian pharmacy space. So it means we need to go out. If I had to go out to go and publish, we'll have the payment of publication charges, publication fees, and so it will become a problem. But what do? You can start from somewhere. There are also journals that are indexed, that are cheap, or that are even free. With some of my colleagues, I told them that for the last 5 years or 6 years, I've chosen that I'll never pay a penny again to publish any work. Why? Because I'm aware that if I can do the work well, then there are opportunities for me to publish them in good journals without paying any penny. Finally, I want to mention what I made number one here, limited funding and resources. Yes, we are not in a country where research is given their priority. So you don't hear people saying that I'm giving funds for research. Go to our PSN conferences, go to our IPG conferences, go to our pharmacy, CPAN, AHAPN, NAPA. You hardly see, what I want to say that this fund is dedicated to fund research in this area. We hardly see also want to say that this award is given to the person that conducted this research in this area. Rather, what you see is about maybe Lifetime Achievement Award, Fellowship Award, and things that will just go on without any much contribution to the field of research. So it is a problem. But like I said, there are always ways out of these challenges. If you are a young person, don't open the one that will be too big for you to handle. In your area where you are, look at where you are sitting. You are sitting on data. Look at where you are walking through every day. You are passing through data. Just look at where you are talking to individuals. You are passing through information. You have colleagues. Since we started this thing, for instance, this mentorship program, what have you done? I expected somebody when they were talking about the this clinical research project. When I asked that what are topics that we're interested in, I wanted to see somebody else say that my interest is to conduct a study, a pre-post study of the competence of any career clinical pharmacist in Nigeria as far as research in this area is concerned. So it's what you just need to do is that before starting this program, you bring out your questionnaires, give out to people through Google form, through SurveyMonkey, Kubo. Let them say something, you document it. Then I'll do this talk. After this talk that will end very soon, you document it again and find out what they have said, what they know, and what they have improved as far as research is concerned. That is a way to conduct research. Open your mind. There are lots of opportunities. But to do that, I know that we can't just start research if we do not have the idea. So what do you do first? The first step is for you to identify your research interest. Which area are you interested in? I like to tell my colleagues, be interested in areas that in the next 20 years will have relevance. Don't go and take an area of research that you just invoke today. You run into it, and after 2 weeks, it goes away. I was asked to review a manuscript last week for a journal. And my first comment was that they were talking about the knowledge, perception of something that has to do with COVID-19. In 2025, who is interested in that? But if you're able to tweak it to say that, okay, preparedness for pandemic, a case study of COVID-19, people will be interested in it. Because at every point in time, we have emerging diseases. We have Mpox now. We used to have Ebola. So don't just bring your idea to something that is local, something that may not go beyond this point. Look for a topic. That's why I tell people whenever they're going to start their graduate programs, masters and PhD, I always tell people, look for a topic that will make it relevant forever. I chose health economics. In choosing an area of healthcare, I also chose HIV. HIV can never go out of book as far as research is concerned. Similarly, health economics cannot go out of book as far as research is concerned. I can do health economics in malaria. I can do health economics in HIV. I can do health economics in typhoid fever. I can do it in COVID. So you can never go out of existence. Then let's take HIV, for instance. If you have HIV, there are different aspects of HIV: quality of life, knowledge, satisfaction with care, or anything that you can think of, they're all coming. So whenever you go to identify your research interest, let it be something that you as a person will know that in the next 20 years, after you will see quality to come to the table to discuss your area of interest. Then you just go into that place blindly, conduct a review. Don't just start something, conduct a review. What are the gaps that you want to identify and solve if you start this project? What have people done before you? And what do you see as their lapses, as their limitations? Go to where they mention limitations themselves and identify what their limitations are. And at every point, whenever you're going to develop a research question, always use a framework. So when you all mentioned your areas, your topics the other time, I just moved them into an AI. I asked DeepSeek, I asked Gemini to assess these topics using any of the frameworks. You can hardly see any work anywhere in the world today that does not talk about a particular framework. The most commonly used one is what we call the framework. So if you have a topic, you have a research question, the first question that's going to ask you, if they ask you who is the population, you should be able to say that this is my population. So if you take a topic out of what our colleagues wrote earlier, let me take one now, the role of clinical pharmacists in managing polypharmacy in mental health patients. So who is the population? The population is pharmacists, clinical pharmacists. What is the intervention, clinical pharmacy services in polypharmacy? What is the comparison? Those that do not have polypharmacy. What is our outcome? Improve mental health care service. This is a topic that can enter into the PICO framework. So at every point, look for what you can. I'm sure you'll see more than 10 different frameworks. Even this PICO can be also edited, and it can be tweaked a little to add other components. But this foundation is this PICO. Always have a population. Who are your people of interest? What is the intervention? Whether it is retrospective, whether it is a cross-section you're going to do now, whether it's something that's going to be longitudinal, you should have an intervention of interest. Then it should be the comparator. It should be the control. It should be the one that will not be exposed to the intervention. It should be the one, whether it's a cohort or a case control, retrospective or in the future. What should be that comparator that you want people to compare with your own current area of interest and you are satisfied with? If somebody says that you want to optimize pharmacy provision of care to patients in Eastern Nigeria, what they will ask him, what is the population? Patients in Eastern Nigeria, how are you able to conduct a study? So I'm using the other one now, final feasibility. Are you able to conduct a study in the whole southeastern state of Nigeria, teaching hospitals in Nigeria? What will be the enough population that will tell you that this 20, 30, 40 is enough to cover the whole of the southeast? Is it interesting? Who is interested in using technology to optimize pharmacy care? Many people are interested globally. People are talking about AI using robots. So people will be interested. Is it novel? Go and check the literature. What have you done about it? I, for instance, have done a scoping review on telepharmacy with some of my colleagues and its role in the LMICs, which includes Nigeria. So it's not necessarily novel again, because I need to saw 8 studies that have been done about it. Is it ethical? What you're going to do, is it ethical? Does it disadvantage some people? Does it make some people to have better outcomes that could lead to problems in other people? How ethical is it? If you want to conduct a study, I want people living with HIV, there's this hospital in Gombe, as one of our colleagues talk about it, and I see that his interest is to promote medication adherence. I want to do a retrospective study. How do you promote adherence to people that have done something before? It's no more relevant. Our interest is how do we do it now to make people to be more adherent to their medications. Then you must choose the right study design. Like I said earlier, what we are doing today is just an overview. So you're not be able to see a lot. But there are different designs that we use in studies, and you must choose the right one. Like you say retrospective study for this aspect of the topic that has to do with promoting medication adherence is a no-no at all. That cannot work in any way. So have the right design. Are you going to be observing? Will it be qualitative? Will it be quantitative where you use more of data? Will it be more of numeric data, or qualitative where you use more of words, in-depth interview, focus group discussions? Which one are you going to use? Are you going to do a combination of both qualitative and quantitative, which we call the mixed method research? There should be an idea of what you want to do. Then they say that people see far because they stand on the shoulders of giants. Always seek mentorship. Always seek people that you are going to be talking to that will guide you. But remember, people are very busy. So it is for you to pursue your mentors. Not for the mentors to pursue you. It's for you to say that I'm available. Use me. I'm available. This is what I'll need. Send a message. They don't reply. Send another one. They don't reply. Send another one. I sent a message to one of my mentors, professor, last week through email. I have not gotten a response. I sent WhatsApp message. I intend to also send another WhatsApp message to remind him. Even if he has sent the other one, he promised to get back to me ASAP, but has not. I'll not stop. I'll keep reminding him so that he gets me what I want. It's not his responsibility to remember me. It's Not a responsibility to, in any way, say that this guy is suffering, let me go. No, it's my responsibility to seek this mentorship and use the mentors well. Finally, if you're going to conduct any clinical pharmacy research, you must comply with ethical standard. Which if it's not local in the facility, go to the HREC committee, Health Trust Ethics Committee, and get an approval. Follow given guideline, follow standard guideline in getting your approvals to conduct the studies. I want to give things that can actually help us now. Facts that have worked. One is you must build a network. You can't do it alone. It's very difficult for you to conduct research, and so you need people. Some of you have taken the right decisions. You are members of the Association of Nigeria, so you are members of a team of professionals who have goals, who have people that have attained certain level of expertise, certain level of success, and they are able to guide you whatever you want to do. So join these associations, local association, international association. Be active. Go for conferences. Introduce yourself. Meet people. Ask for their contacts. Ask for their cards. Tell them that you are involved. Read about them. If you see somebody, you just see somebody sitting down in that side. You see who is this person. This is Mr. This is Master Dad. This is Doctor. This is Professor Dad. This is Chief. This. Read about them. Just open your phone. Read about their profile. Go and meet. When you go to meet them, talk about them. Not from a period of ignorance. I read your work on this area. I saw your philanthropic contribution to this. I saw your academic publication in this. It will make them know that this person is interested and wants to work. To attend conferences, don't just stay on your own. And as I tell people, the many conferences, even though the funding withdrawal funding from the US is affecting the funding of many conferences, but I see some of them that are available that you can be funded to. So attend conferences to help a lot. There's no secret to that. One of my professors, when I was to go for a conference in Benin Republic last year, he told me something, and let me call his name, Professor Mattis Emeje. He told me that go for that conference, because in that conference, you will see what you can read in any clinical pharmacy textbook. So you will read, you will get to know what you can't read in any clinical pharmacy textbook. And after the conference, I agree that is true. From that conference, I've made connections. I've collaborated with experts from different areas. I've seen people that work in NIH, people that work in different areas of opportunities that I've leveraged on to do many things. They use the social media wisely. Don't make that be the person that is just a social media to be posting. I'm happy to inform that I have attained this certificate. That nobody may be interested in your certificate. Don't be the social media user that is only interested in birthdays. Use your WhatsApp, your LinkedIn, your ResearchGate. Use them responsibly. Let them know that somebody that is responsible, professional, is talking. I have an opportunity recently that the only way that I got the opportunity was that somebody went on LinkedIn. I was looking for a person-centered care in HIV, and he saw my name. And he contacted me, and we started talking. Today, we've established a team, and we're doing something very wonderful. The last thing in this aspect is that come together and establish a team. It is easier for a mentor to attend to 20 people in a team than attending to one person individually. Like I tell my colleagues, whenever people ask me, please help me to review my research question, help me to look at my topic, help me to look at my abstract, so that I can't attend to everyone at the same time. I have many responsibilities. But if you are coming as a group, I can attend to people at the same time. And so it will reduce the number of things that I have to be explaining. It's best done if you have a team. So come together, gather yourself, even among this mentees group, come together and form groups that you can use in conducting researches. Now, I want to tell you that although funding is difficult, there are some that can still get. I have deliberately refused to add US-based funds to this list because of the current reality that we're all passing through. But I want to tell you that there are other funding agencies that are available nationally and internationally who are interested in what you are going to do. Christian Limited Fund called for they call it, is it a research, a form of fair, research fair. They just call people to come and showcase whatever they have done as far as research is concerned. They're not restricted to only lecturers or to people in academia or people in the hospitals. It was open. So tap to those opportunities. NEMA is doing a lot. I'm aware of many groups that they go to NEMA, that they are mentoring them in research, both for young people, university undergraduates, they do for them, they do for any career people, they do for successful researchers. A lot of them, NEMA has a lot. Go to that place and get information. Still locally, we have Dangote Foundation. It's involved in funding many studies. We have SFH, we have CHAI. These are bodies that are conducting research. So get to know people among them and say that these are your interests. This is what you want to do. We also have some international funding bodies that are also available that give funds to people of different classes. So explore them. Go online, look at their grant page and see what they are doing recently and see the one that you can go into. There's a book that's published annually called The Grant Register. Open the Grant Register, you see a lot of opportunities available that you can tap into. In all, you will have to conduct, develop a research proposal. It's not something that we can do at this time, but I should tell that in summary, what they want to see that you have a clearly defined objective in your grant application, and that objective should be able to produce findings that are relevant not just to your local organization, but also to the global health space. And at every point, tell them that you're going to conduct a realistic work. Your work should have a budget that is true. Last Saturday, I was in a meeting with a professor from Warsaw in the United States, and she made something that she said to made us laugh. We talk about conducting a study among 100 pharmacists, community pharmacists in Nigeria. You and I know that that is not too much for a Nigerian, and the budget was $50,000. She said, no, for them in the US, that is not realistic. They can't give you, they don't believe you want to do the work well. That $50,000 is not enough to go to 100 community pharmacies. So always know that there's a difference between what we have in Nigeria and what the global health community is interested in. So let's choose the one that will do the right thing in your locality, meaning that you attach to it. I want to end by mentioning that whenever you're going to publish any work, please, I know many of us that are involved in research. Unfortunately, because of the haste, because we want to be known that I've published 10 works, I've published 20 works, we don't determine the right journal. Please, whenever you're going to do a study, please look for studies and publish them in journals that have this global reach, that have the good scope, that have the audience. What is the visit? Go to Scopus, search for the journal on Scopus. Are they available on Scopus? Search for the journal on Web of Science. Are they available on Web of Science? Go to places like SNP, go to places like AJOL, African Journal Online, and see if these journals are indexed. If they are not there, you may be wasting your people. It will be published. It will be counted for you. It will be cited. But if tomorrow you give somebody opportunity to review your work, they'll tell you that what you have done has no impact as far as the global research is concerned. At any point, always follow the guideline of the journal. Don't follow your own, because nobody's, we're not talking about you. We're talking about what the person wants. So if they give you guideline, follow the guideline in conducting your research. Then let me give you one secret. You're going to see a lot of rejections. You may apply to the research group, you'll be rejected. You may have done a very good work, submit it for a conference to be rejected. You may do a very great work, submit it to a journal and to be rejected. That should not bring you down. On Monday, I was one of my mentees who is an intern pharmacist, whose abstract was accepted as an abstract book paper for the HIV Women Conference holding in Spain, Barcelona specifically. Because it was accepted just for the book of abstract, she felt down and could not say it out for people to hear. I said, no, you've done great. Your first abstract that you have ever sent out that's accepted in this a conference and is accepted for book of abstract. You have done something. Some were rejected, but more than half were rejected. So you are one of the lucky few. You have those that will become poster very soon. You have guided poster very soon. You have mini oral very soon. You have oral very soon. So always take rejection to be something that will always come and build on them. At any point that you see any feedback from the reviewer, let it be something that will make you to prepare your work. And sometimes know that whatever you have as a feedback, if you use it well, you may actually do something that is better. Sometimes also, you may have a rejection that without any work done on that manuscript, it will be accepted by a better journal. Let me give you an experience. We have a work that is published in American Journal of Pharmaceutical Education, AJPE. That is the best pharmaceutical education journal in the whole world. AJPE, American Journal of Pharmaceutical Education, is the best pharmacy education journal in the whole world. The first Nigerian to publish in that journal is Professor Chukwemeka Obaka, the current Commissioner of Health for Tertiary and Secondary in Imo State. I was lucky to be the second and also the third, because I now have 2 works published in that journal. Our last work that was on effect of strike, of industrial action on the academic performance of pharmacy students in Nigeria. When we did that work, we submitted it to Current in Pharmacy Teaching and Learning, which is a lower journal than AJPE. You know that this Current in Pharmacy Teaching and Learning rejected the work. We would never review it. We never revise anything. We just submitted it directly to a higher journal and it was accepted. So take it that you get rejections and there are always ways to go out of it. I want to end by telling you that it is possible to conduct research in Nigeria. It's possible to conduct research that are of great values, and you can use it to do anything that you want to do. Look at this work, for instance, published in Journal of Workplace Behavioral Health. This is a high impact factor journal. It's a journal that has a lot of credibility, published by Taylor and Francis, a reputable publishing organization. How did this work come about? We had a lot of colleagues who were interested in research. They were all YPG members, either interns or core members. So I told them, don't think far. Let's do this study among you. Let's do this thing among you and see what you can come up with. So whenever you hear interns, the first thing is that they'll tell you that they'll not tell us well, they'll be telling their lecturers, you don't tell them that this is how outside is so. So it means that there's the issue of job satisfaction. There's the issue of how can I tell that you're going to work 8 to 5, call 3 times a day, call 6 times a week. People are angry. So that is your environment. Let's do a study about them. And we did a study about core members, intern pharmacists, and those that are just less than 5 years graduation. And we're able to have a very good work that found out that there's a direct relationship between quality of work life and job satisfaction, that the higher the quality of work life, the higher the job satisfaction. So that those things, those factors that predicted job satisfaction were the salary, those that they paid higher, felt more satisfied with their jobs. Those that got assistance from their employers had better job satisfaction index. Those that were given a form of health insurance, like it's done to some core members, some interns during their internship programs in some teaching hospitals, they're able to get medications at reduced or even no cost from the hospitals. It's improved their job satisfaction. And funny enough, the length of leave, workplaces that had leave period that was lengthier expressed job satisfaction that was better, and those that had very short period of leave. And you see, if you look at all these people that are co-authors in this work, some of them have left this country through opportunities that they got from this work that I've done. The second person, Samuel Ofili, is currently outside the country, pursuing his PhD, as this is outside the country in Jude is also outside. Victor Amici is outside. And many of these people that you are talking to now are outside this country. And when it is time for interview for these people, there are people that you are sure that if they stand before anyone, they can tell you that they conducted the study and this is what they're able to do in their work. In conclusion, I want to tell you that there are tips that could be used in balancing these challenges that we mentioned earlier. Look at how to use your time very well. Yes, it's difficult at this stage because you're working under somebody, but you can still try your best to allocate time for relaxation, for your research, no matter how short it is. Just say 2 hours in 3 days, 2 hours in 1 week. It's better than nothing at all. That you are going to sit down, dedicated on your laptop, using your phone, your tablet, to do something about research. It will go a long way in guiding you. They use technologies. Today, we have many technologies. We have our AIs, we have data analysis tools, and with responsible use, I can assure you that they make work a lot easier. When DeepSeek came, and the first day that it was launched in this journal, and somebody told me about it from the US, Philadelphia, and I opened it up. I saw that it has a lot of advantages. I was able to synthesize data from a data set of over 1,000 different entries in Excel sheets just by using the AI. So The opportunities today, and if you master them, you'll be able to use them. Then always advocate to have time dedicated for research. If you don't have it, establish it. If you are doing your internship, your NYC, in PCN, in NAFDAC, in a community pharmacy, tell them that we need a research unit. Tell them the importance. You publish works and put their names. You go to conferences and put their names. And that's how the global village is running. People are always talking about what to do to become more relevant. I can show you that we have a lot of prospects in Nigeria. I'm aware that many clinical pharmacists are not being involved in research in key areas in the healthcare system. I'm also aware that people are now diversifying because of this increase in the disciplinary research, that you are in pharmacy, somebody is in nursing, somebody is in medicine, another person is in law, and we are conducting researches that begin of very important information. And now we have governments that are also asking for evidence for decision making. So now that there's the issue of the House of Representatives passing a bill to be involved, to involving pharmacy assistants as independent bodies, not under PCM, but under their own regulatory body, who has thought of a study to conduct, to ask people in the villages, ask people in the cities, rural and urban areas, do you feel safer with your drug, with pharmacists than pharmacy technicians? Who do you think should be done to regulate the technicians? Should it be pharmacists or non pharmacists? Conduct this short focus group discussion, in-depth interview with a few number of people and publish it. People will bring it up as evidence if you talk about it in the next point that you meet with anybody. I will advise that you start small. Don't think of all these big names, big journals that I've mentioned. Start in your own small way, seek collaboration with your peers and gather and start applying for funds, no matter how small. Ask for 10,000 for 20,000 naira and conduct studies that you can be able to. That I can. If you do very, I'm sorry to talk because to my concluding remarks, I was just saying that I think it's now time for us to discuss and see what we can do to be of help at this stage. Like I said, this is just an introductory class, not a teaching on how to conduct clinical research. That cannot be done in just an hour. But with this little talk, hear from our participants and
Hello, Dr. Isa. I don't know if you're still online. We seem not to be hearing anyone.
Mrs. Bitrus, can you hear me?
Yes, the audio went out some 5 minutes ago, but I can hear you now. And it seems like many people were not getting you 5 minutes ago, Cha.
Okay, so I'm saying that. Okay, sorry about that. I think that was the point that I was saying, that it was not time for an open discussion with everyone on the group.
Okay, so I don't know, Pharmacist Mike too was not hearing. So I don't know, Pharmacist Mike, if you are over to coordinate the questions and the answers for us.
Okay, thank you very much. Thank you, Dr. Isa, for that wonderful lecture, very incisive and concise. And just by way of, let me just go through one or two things that he mentioned, and then we give room for questions and answers. The first, one of the key points was that one of the reasons why we need to conduct research in clinical pharmacy, there is need for evidence-based practice and then for policy making. And we can look at some of the importance, such as patient care through evidence-based practices. And then we need to look at something that we address local and global health challenges. One of the other things he mentioned is that we should look, when we are looking at researches to do, because we should look at something that is not just in vogue now, but something that can endure, something that in the next 20 years, you can still conduct research on it, you can still be relevant. And I actually talked about collaboration, that is not something that can be done alone. You need to collaborate. You need to actually stand on the shoulder of giants, seek mentors. And another one of the major points he also mentioned was that researches can be done in any setting. Like, don't think that because you're in Nigeria or you are still an intern or you are this, anywhere you are, a research can actually be done and it can be published. A good example is the one he showed us about the impact of job satisfaction, and which has been published in a very reputable international journal. And it's something that was even done among interns at that time. And also mentioned the fact that we should, there are some funding sources that it's good to look at it. And then it's good to also look at the journal you are looking at, not to take rejection personal, that even be prepared for rejection. If there's any rejection, just take it as a stepping stone. So I want to open the floor for questions so that mentees especially can ask questions, and this can actually be a springboard for more enlightenment. So the floor is open. If you want to ask a question, you can actually signify by raising up your hand, and then we give you the opportunity to do that. So you can signify, then we give you the opportunity.
Good evening. I'm trying to see where to raise my hand. I don't know if that's obtainable in Zoom.
Okay.
But I don't know if I can be given the audience, please.
Okay, go ahead, sir.
Okay, my name is King David Ahunchwago. I'd like to appreciate Dr. Isa for this lecture. I actually learned a whole lot of things. So I have a few questions to ask because I'm very much interested in research. Yeah, Dr. Isa knows. So my questions are as follows. The first one is that he mentioned looking at topics that have both international and local attention. But oftentimes I discover that when you go into common topics like diabetes, like hypertension, and you research on them, the chances of getting rejection is high from what I've experienced. And the lines would always be things like that, okay, that this work is nice, but then currently that they have so many works for consideration, and hence they are not they won't be able to consider this. So because of course there are so many people researching on either hypertension, that's the one I've had personal encounters with, or diabetes, or all of this. So I feel they tend more to tilt towards topics that may not be fully explored. So how do we go about that? Now my second question is, does the topic affect the sample size or the geographical spread? Because there's this work we worked on. We were looking at social media use among young people in Nigeria. And then by the time we sent the work out of publication, they were like, no, that there is no way we can do such a work, and it has to be in Nigeria, that it should be in a state or in a local government or something like that. And that was the basis for rejecting that work. So these are the two. There's a third one I wrote down somewhere, but I'm trying to get where I wrote that. Yes, thirdly, on the issue of collaboration, currently a colleague drew my attention to a criterion rather, when you want to apply for something, they will say a work that you are the first author or the sole author. So you see people, they want to produce works that they are the sole author, only them wrote. So what is the place of sole authorship in collaboration, especially as regards to research? Thank you so much.
Okay, so Dr. Issa, I think you can respond to that, sir.
Okay, thank you, King David. As an editor myself and a reviewer for many journals, I want to first assure you that some of the statements that you see during rejections are not necessarily the reason why they reject the work. Sometimes they're just not interested. Sometimes they're overwhelmed. Sometimes somebody has published something similar to that. It does not make your work to be any less important. I'll give you an example of a work that was published in British Journal of Clinical Pharmacology. That is the flagship journal of the British Association of British Clinical Pharmacologists globally. And the work was what? The impact of pharmacist-led interventions in hypertension self-care management in Nigeria, conducted in Lokoja and Abuja. And it has been published more than 2 years ago. So what is the relevance? It is relevant. Just that if you do something like that today, it will not be accepted. I'll not publish it in a Nigerian Journal of Pharmacy or in any local journal. We sent it to the UK and it was published, accepted immediately. We're currently doing a study with about some of my colleagues, my mentee, a 50-year FAMD student, not final year FAMD student. We did a study that we finished data collection today. Now, our interest is to publish that work in diabetes, global, not just BMC, diabetes, where we're going to send it for publication. So what is the rigor of your design? What is the rigor of your report? How credible is your report? What is the depth of analysis? How did you interpret the result? What are your comparators to findings of what exists before you? How do you distinguish your own from other people's publication? That is what stands yours out. So yes, do local that have international relevance, do it well, and I can show you that no matter how big the journal is, they will accept it. I'll just give you an example. A book that we published last year in the American Journal of Pharmaceutical Education, American Journal of Pharmaceutical Education, about the impact of ASU strike on the productivity of pharmacists in Nigeria. Is that not Nigeria a Nigerian problem? How many pharmacists go on strike in US, or lecturers go on strike in the US? It was published in that journal, which is the world's best journal of pharmaceutical education, just last year. So you can see that that one was in the past. It's still relevant. So it is more of the quality than whatever reason that they give you. In most cases, editors don't just throw your work out. They look for reasons. We have competing interests. Sometimes we have this and that. We don't know what to do. So please manage. That's just a statement. But I can show you that it is better to have local interest with global relevance. So the second question about the topic. For me, the topic is everything. The topic is everything. So it's enough to reject a work because your topic does not pass enough message. Today, when I was reviewing, I told you the other time, I was reviewing somebody's work about the knowledge is equality of life and something with people, with adolescents, about acne vulgaris. And she put adolescents in Nigeria. I asked her, how many population do you have? I mean, how many sites do you have? Are you going to have one state in each of the geographical zones? She said, no, I said, your work is dead on arrival. I have done a study that we call it a Nigerian-based work. Why? Because we make sure that we captured every single of the 6 geographical zones in Nigeria. It's not to call it a national work. We did a study about the GRIT. There's work that we published in Pharmacy Education, the journal of FIP's journal, Pharmacy Education. We call it GRIT and its factors. All those that have to do with how people are resilient in pharmacy schools in Nigeria. We made sure that we had one pharmacy school in each of the geographical zones in Nigeria. It was enough for it to go out to international journal and it was published. So it matters. So if you're going to have a title, a topic for your work, there should be the what. What is what you're actually studying? What is the concept? There should be the how. That is, what type of design did you use? There should be the where it was conducted. It's very important. So if you're not able to convince readers, editors to start with about all these things, it's enough to reject your work if your title does not pass enough message of what they expect from you. Then finally, on the issue of collaboration and first author, it's something that usually causes a problem whenever it's time for authors to publish work. So I always advise that at the beginning, you come together and agree on who will be the first author, who will be the second author, and all those things. Because yes, it matters a lot in what comes out. It matters a lot in what comes out. So discuss it, agree on it, and tell us what you want to achieve. If the interest is conference, then agree. Let's do 2, because only one person will be the presenter. If there's a scholarship, they'll give it to just one person. So let us do 2 so that we can have 2 presenters for 2 different work. But 2 of us will be co-authors, and so we have a larger distance. Then, like there's a group of work that we did in my team, the HIV Person Centered HIV Research Team. From the beginning, I said that it is the mentee pharmacist or clinician, because we have people from different areas in the team, that it is the mentee who we call the group coordinator that will be the first, that will be the presenting author. But the first author will be the mentor, the supervisor, the professor, the senior lecturer, whoever. They are the first author, but they're not the presenting author. So they will not feel bad. They have contributed, their name will come out, it will be cited, to be taken to a conference. And at the same time, the young person that's going to work will be the presenting author. We should give room for our people to develop and also make this impact that we're talking about. So you should agree as a team. If we're going to submit a paper to a conference next year, and we intend to publish, to have it presented as a poster, as an oral presentation, let us agree from today. How many works are we going to prepare? Who's going to be the first author in this one? Who will be the first author in the other one? Agree. At the end, it's better to have one work that you are the presenting author, in addition to 5 others that are co-author, than to have one that is only you, that is the sole author, and tomorrow it will not even fly at all. It will be rejected, and that means you have put all your eggs in one basket. So not a problem. I still insist and encourage that we should be involved in collaboration. We should be involved in conducting studies that has to do with more than just 1 or 2 persons, because of the fear of the authorship. Once we have our SOP, we agree on what to do. And the time should come that we that have gained some experiences, we that will have some publications, we also leave room for our younger ones to grow. I work with some professors today. I remember my PhD supervisors, Professor Ukwe and Professor Konta. They told me something at the beginning of my PhD that they are professors already. They're not looking for who is number one or number two. That in any work, I should put them as the last. No matter what they contribute, they should be the last authors. Let us, the younger ones, hear the name and carry it up. So, yes, you have people that may be selfish also. That will not want to do this for you. But that should not deter you at all. Keep working, increase your reach. When they say that they should bring one, bring two. At any point that they're doing just one study, try and see something that you can add to your own. So that if it's time for submission, even if they submit the group one, you have your own individual one that you're able to submit. I hope I was able to respond to your concerns. Thank you.
Yes, thank you so much, sir.
Okay.
Okay, thank you so much
Is
for
there another
Dr.
one?
answer. Is there any other question? Okay, if you have any question, you can unmute yourself and ask. If you can't actually raise the hand, just unmute yourself.
I think we can call it a day today. It's almost 10 p.m. and there are no other hands raised by anyone.
Well, it has been a wonderful time. I think let me give the room for the chairman of SIPA Think Tank Committee to give the vote of thanks and take the concluding remarks, the closing remarks.
Okay, good evening all once again. We want to specially appreciate each and every mentee and the mentors that were on this platform this evening. Much thanks on behalf of the SIPAN mentorship team goes to one of our own, Dr. Isa, for giving his time and giving us this very insightful and enriching presentation this evening. We hope that personally, I would love this particular discussion to go a little mile, maybe in another session. But then for now, just like he said, it's just an introductory aspect of the research. So we hope that the mentees have gainfully gained something this evening, which we would continue the discussions on the platform together. So want to once again, on behalf of the SIPAN National ESCOs, the SIPAN chairman who was on the platform, the vice chairman who was on the platform, Dr. Biajiru, I think she's still on the platform. We are so grateful for your time. We're grateful to our moderator, Pharmacist Mike, and for everyone that made it to the session this evening. We pray that next time we would also be available to learn and increase our own knowledge, and above all, to be of immense benefit to the patients and the people that we have been brought to their doorpost at work. So thank you so much from me. We are grateful all. Over to you, Farm Mike.
Thank you very much.
Paul.
I think with that, we can call it a day. Thank you very much, everybody. Have a wonderful night. Thank you, Dr. Isa, for your time.
Okay, good night, everyone.